welcome to Pharma Television News Review here at the 4th Midkine Symposium in Budapest in April 2016. On this show, I have Professor Gonzalo Herradon, who is a professor at the Universidad CEU San Pablo, Madrid. Welcome.
Thank you very much.
Just the first question really is could you describe how your research impacts on the area of drug abuse, particularly in relation to Pleiotrophin and Midkine?
Well, I can try for sure. Our approach is that addiction, of course, is a really big problem almost everywhere in the world. Let's take alcoholism, for example, in Europe,
Absolutely.
that it costs in the European Union 155 billion euros in alcohol-related disorders. So we think our body is always reacting against something that is hurting him. For example, let's take, if we drink alcohol, we are going to produce a change in the protein levels of several proteins in our brain to try to protect us against, for example, neurotoxicity induced by alcohol, or even to develop this drinking-like behavior, escalating doses of alcohol and so on. So we found that Pleiotrophin and Midkine are upregulated in the frontal cortex in the brain in humans,
Right.
in human alcoholics, and we thought that Pleiotrophin and Midkine were there to try to regulate the deleterious effect of alcohol.
Right.
So using animal genetic models, we found basically the most important result that we found is that animals that do not express Pleiotrophin or do not express Midkine, they become more addicted to alcohol. The rewarding properties of alcohol are exacerbated in those animals. And conversely, if you have a mouse like we have that is overexpressing Pleiotrophin in the brain, that animal, it was kind of amazing because the rewarding properties of alcohol were almost gone.
Right.
So that is something that is very valuable in pharmacology, because what you want to interrupt always in addiction is what we call drug-seeking behavior.
Right.
So it's just a matter of, you take a couple of drinks and you seek the third one, and you seek the fourth one, even despite that you know that probably that is harmful for you, that is harmful for your family, that is harmful for everybody else, but you still keep seeking the drug.
Right.
So if you can stop the rewarding properties of a drug,
Right.
you can stop that kind of behavior.
Right.
So for that reason, we were interested in getting deep in why overexpressing this cytokine, in this case Pleiotrophin, can stop the rewarding properties of alcohol, and in this way we can help people with this kind of alcohol
Right.
use disorders. In the same way, we have done also experiments with psychostimulants that are a little bit more complicated, because it's not only the rewarding properties of psychostimulants, but they have very harmful neurotoxic effects. And when you combine alcohol and psychostimulants, like for example adolescents do a lot, the neurotoxicity is potentiated.
Right.
So we found, and this is a little bit more complicated, but we found that these cytokines also regulate the neurotoxic effects of these drugs.
Right.
So we may have a tool to regulate the rewarding, the drug-seeking behavior, but also the neurotoxic effects of these drugs.
Right. Okay. I mean, it's interesting that both alcohol and amphetamines have the same effect. How do you explain that?
Well, I guess you are talking about the addictive effects.
Yes.
So basically, addiction, if you like chocolate, that is going to produce mostly the same pharmacological effect as alcohol or amphetamine, or let's say sex or anything else.
Right.
Basically we are activating the rewarding system in our brain.
Right.
That mainly comes from VTA, that is too specific, but basically it's dopamine release in specific areas of our brain.
Right.
That are giving us pleasure, and they are just wanting more and more and more of that experience.
Right. Right.
So all drugs and all pleasurable experiences goes that way.
Right.
So that is normal. A different thing is the neurotoxic effect.
Right.
That is probably every drug produces a neurotoxic effect from a different mechanism of action.
Sure.
For example, amphetamine is just mostly about excitotoxicity. Alcohol can produce apoptosis in neurons, leading to neuronal death. So that is different. But the rewarding properties of all drugs are more or less going through the same pathways in the brain.
So just to bring Midkine and Pleiotrophin back into this. So they clearly have a role.
Mm-hmm.
How specific can we get in terms of that role?
That is a very important question. As a specific, all the specificity that you can get from this is how can you define the mechanism of action of Pleiotrophin, for example, or Midkine, to stop the rewarding properties of drugs. So we think our studies really evidence that it is one specific receptor of these two cytokines that is the one mediating all these anti-rewarding effects of Pleiotrophin and Midkine. So basically, Pleiotrophin, as we have seen in this wonderful symposium, has a wide variety of effects in the central nervous system because you have many receptors working for Pleiotrophin. You can be angiogenic, you can have effects in memory, you can have effects in the heart, in many other places. So you need to touch just the receptor that is involved in regulation of the rewarding pathways. So we believe that receptor is RPTP, beta zeta. So I am a pharmacologist. My job now is try to design a specific molecule that can get to the brain, cross the blood-brain barrier, and produce the same effects as Pleiotrophin, but only binding to this specific receptor, not all the other receptors of Pleiotrophin. Then I think we have something that can be druggable.
Indeed. So in the end, just to Pleiotrophin and Midkine, they're modulators. They play an important role across a number of receptors, but they in their presence or their absence of Pleiotropin and Pleiotrophin in the levels can have a complete different outcome.
Exactly.
For a patient or an adult drinking alcohol or amphetamines. Just finally, where does your research go now?
Well, I would say two different ways. Precisely because this last comment that you make, we can envision also PTN and Midkine as biomarkers. That is so important. For example, just a problem that we have in clinica nowadays. You have a guy with in severe pain, neuropathic pain or a kind of pain that requires high doses of opioids. But he's a guy with a history of alcoholism. There is always concern giving opioids to a guy that has a history of addictions, for example. That guy is likely to reproduce a drug-seeking behavior with the opioid, for example. But also, we can have a regular guy with mutations in the genes of Pleiotrophin and Midkine that are reducing the functions of Pleiotrophin and Midkine that, during the adulthood, they are not so important. So if you don't have those functions, you can live until you get contact with this kind of drugs, and then you develop more likely an addictive behavior. So we envision Pleiotrophin and Midkine as biomarkers that can even predict if you are more likely to develop an addiction behavior, or if you are already an addict, it can be a biomarker for the treatment that we are giving you just to try to quit the use of drugs. So that is one path that we want to follow, biomarkers. And the other one is these drugs that we are designing. We are now just in the validation of these drugs in preclinical models. So we are about to finish the in vitro testing with the nice collaboration of other authors in the field. And the results of, we have tested like 20 or 23 different compounds. 4 of them are positive almost in every test in vitro. So we now just to have to jump to animal models, like the ones that I was showing in this symposium, and trying to reproduce those effects that we see with the overexpression of Pleiotrophin in the brain that you block the alcohol rewarding properties. So let's see if this molecule can do that. And also, on the side, we, it's not the important thing about this interview, but also we can use that molecule in all the beneficial areas of Pleiotrophin, including neurodegenerative diseases. So our main focus is addiction, but we have some side effects. In this case,
you're bound
very
to
good.
come up with molecules which have different effects.
Exactly, different effects that can be useful in different applications. So we will follow those paths in the future.
Professor Herradon, thank you very much indeed for coming on the show.
Thank you very much for your invitation. Thank you.